So what are we doing today?
We are here. We are going to do a little bit of Juvederm, 2 syringes of Voluma spread across Kate's beautiful face. We're going to enhance her features, give her fullness and definition to the lips, enhance the structure of her cheek, bringing volume to the mid-face, bringing that beautiful S-curve out just a tiny bit. Dr. Jeffers will be administering these injections today. We're really excited. So we just numbed the lips and we are getting ready to inject. What area are we injecting first, Dr. Jeffers? The lips?
Yeah.
Alrighty, are you ready?
Doing okay?
Yeah, feeling good.
How did that first initial injection feel?
Not too bad.
Yeah, it's really not bad. So you're numbed before, and there's also lidocaine in this filler. This is Juvederm Ultra XC. Personally, one of my favorite fillers for the lips. It's just a hyaluronic acid that's been refined into an injectable gel. What our body naturally produces. But this is beautiful. Looking good.
Open a little bit. Yeah.
This filler is very natural. It loves water, so the more hydrated you are, the better the filler looks. Okay, so Dr. Jeffers is just kind of manipulating that filler into the lip, smoothing it out, so Kate can have a really nice result.
Yeah.
Oh wow, it's already starting to look amazing.
All right.
Getting that perfect pout. I know you've been wanting this for a while.
Oh, I have.
How are you feeling?
Feeling good.
Good.
Now we're going to do a lower. Okay.
So when it comes to technique, Dr. Jeffers, how do you usually like to start the injections?
Well, I do the top lip first, and then depends on what their needs are, but for Kate, she's younger, so she doesn't really need the borders so much. But sometimes people who are older, they may need the borders done first, and then inside the lip. But for Kate, I just did inside the lip because her.
So adding volume to
Adding
enhance
volume,
what she already kind of has. It looks amazing so far. So we're gonna smooth the bottom of the lips out, which is quick and painless. How's that numbing going along, Kate?
It definitely helps.
Good. They're starting to look beautiful.
See how I like it, Kate.
Good. They look
Like
amazing.
that? Yeah. Do you want the top a little bit fuller, maybe here?
Oh, the bottom?
And the bottom probably? Okay.
Yeah, that'd be great.
Okay. All right.
Ooh.
You're doing
Get
really
up
good.
close and personal. Dr. Jeffers is one of our cosmetic injectors here on staff. We have Dr. Jeffers and Nurse Stacy. Both have earned our spa Black Diamond status with Allergan and are incredible injectors. I would trust nobody else with my face. We did just have a little bit of bleeding, which is not uncommon. It typically stops pretty soon after injection. You're usually numb for about 30 minutes to an hour after, so you're really not feeling anything. Discomfort level is usually pretty low post-injection. You may just feel a little bit of swelling, a little bit of bruising, but the homeopathic medicine Arnica, the sublingual tablets or the gel is truly a lifesaver. We offer the gel here in spa, and Dr. Jeffers will apply post-injection.
Yep. More comfy.
Still feeling comfortable?
Oh yeah.
So here we're putting some arnica gel on. It really helps soothe that area, cool that area down.
Helps with bruising.
Yeah, swelling and bruising, keeping it at a minimum is really important because you'd like to leave here, resume your normal daily activities. Of course, post-injection, you do need to kind of take it easy just for a little bit, but nobody will know, everyone will notice. Beautiful.
How's it feeling?
Very numb.
Very numb. Yeah. The numbing lasts about 10 minutes, and then after that, it's done.
Now we're gonna have the Voluma.
Yeah.
Are you ready to enhance that
We have a
structure?
little here,
Okay.
so it'll be a few days, and then maybe 3 or 4 days. Maybe a little puffy when you wake up in the morning. It'll be
Okay.
kind of swollen. That's normal.
Okay.
And then
Perfect.
it's better in the next 2 days.
All right.
Alright, now we can do the cheeks.
So post-procedure for lips, what do you usually say that clients should stay away from, should avoid, or what would make a post-injection more comfortable?
Well, with the lips, they really can apply lipstick or lip gloss. It doesn't matter after the treatment. The only thing I tell them that it'll be swollen the next day, and for them to just let it be swollen. Don't ice it down and don't do anything to it. Just let it be puffy, because then it lasts longer. And then after 2 days, is the final result.
Let's see. Amazing. Now let's get ready for cheeks.
Okay?
For
Yeah.
cheeks, we are using Juvederm Voluma.
Yeah.
Voluma is one of the only FDA fillers approved for the cheek area to enhance the mid-face. Voluma lasts 2 years and is actually pretty painless. It's injected down at the bone, cross-linked to lift, a 90% lower molecular weight, 10% high molecular weight, which gives... Don't want this.
Are we ready?
Okay, so we're about to administer the first syringe into Kate's.
You ready?
I'm ready.
Alright, it goes directly on top of the bone. And that way it gives a fuller look. Doing okay?
I'm doing good.
Let's smooth it out a little bit. A little bit left from the first one.
So Dr. Jeffers is just smoothing that filler out in the cheek. And we just had a question from Billy Williamson. Voluma lifts the cheek. It helps with nasolabial lines, marionette folds. It also lifts the lip, lifts the jawline, brings volume back to the mid-face. And it just really enhances that beautiful, beautiful S-curve, giving you the triangle of youth. So as we age, everything just kind of starts to fall. This is just bringing back everything up into place where it should be.
Even though she is young, but also helps to enhance some aspects of the face that the person, like her future, her profile. But normally is was recommended for people that are losing
Volume.
volume.
But I'm finding even people in their 20s coming in for the Voluma because just the structure of the face.
It's structural. Yeah,
genetic.
you can modify that
Yeah,
structure that they don't like
And men
make it
and
look
women.
the way they prefer it.
Oh, yeah.
Yeah. Both men and women
Mm-hmm.
come in, not just women, but men as well.
So Stacia Hayes asked, can you use this in your lips? We don't use Juvederm Voluma in the lips. We do use Juvederm Ultra XC, Juvederm Ultra Plus XC,
Great.
Restylane Silk or Restylane for the lips. Juvederm is typically for, Juvederm Voluma is typically for just the mid-face area, right where the middle of the cheekbone starts over to the ear. We can also use in nasolabial lines or the chin as well. And Billy Williamson asked, how long does it last? Voluma is studied to last
Supposed to last forever.
2 years. Forever.
But we say it lasts forever because once they get it, they'll come back again.
Oh, yeah.
And get more.
Oh,
So
yeah.
It's forever.
It's addicting.
Yeah.
If I could live in this chair, I would.
But the doctor from Brazil, what is his name again, Dr. Jeffrey?
Dr. DeMaio.
De Mayo, when they asked them how long a volume lasts, he said actually lasts forever. But the life of it really in a person's face is 2 years.
That's right.
But once you see that result, you don't want to let your cheeks deflated again, you know, so you will come back and keep maintaining it.
Like every 6 months, get one more.
Yes.
And to Stacia Hayes, there aren't any side effects with Juvederm Voluma or Juvederm Ultra XC aside from possibly slight bruising. It is just per patient. Voluma doesn't swell because of that lower molecular weight and how it's cross-linked. So swelling and bruising with Juvederm Voluma is typically very slight. Usually not really any swelling. You could go back to work the next day and not even be able to tell. Unless you get pinpoint bruising where the injection was administered. For the lips, there can be slight bruising and swelling. We are extremely vascular in the lips. But typically doesn't really last too long.
Yes, this is fabulous.
This is fabulous.
Yeah. Also, Voluma is used a lot for people that lose a lot of weight.
Yeah.
And they are very skinny, and they lose a lot of weight in the face. And most people want to lose the weight in the body, not in the face. And if they lose weight in the face, this is a great compliment to have a skinny body with your face looking lifted.
Yeah, and younger. I had one patient this week that came for the same reason.
Yes.
She had lost a lot of weight.
Well, Susan told me that she gets volume in her face because you see how skinny she is.
Yeah.
And so she needs that in order to look younger or look her age. She's young, but she loses a lot of weight, volume in her face.
So we're adding some arnica on now. And yes, so it's instant gratification with Voluma. You kind of see what you get. If you're ever hesitant to do any of these fillers, Voluma is great with the instant gratification because you can really see where you'd like to add more.
Yeah, all the fillers are instant.
Yes.
Now all of the people in this room have had Voluma.